Happy Functional Medicine Friday. Dr. Julie McLaughlin here from McLaughlin Care. We're going to be talking about another lab test panel, the deficiency panel. If you missed some of our previous ones, be sure to check them out there in our playlist online on YouTube at McLaughlin Care. And we have all kinds of videos on there that you would love to learn more. So the deficiency panel. So we're going to talk about some blood tests that we do that look for different deficiencies. So deficiencies can also be called anemias. So we look at B12 and folic acid. Both of these supplements are water soluble, and they're the leading nutrient deficiency in the world, the entire world. In 2004, a study came out that said many parts of the world, including US, India, Mexico, Central America, South America, and Africa, have the highest amount of deficiencies for these nutrients. Folic acid is also known as B9, and it's really, really important for synthesizing DNA, producing new cells, supporting your nerves and your brain and your immune function. And the conversion of folic acid into folate is dependent on a gene called MTHFR. And sometimes if we have that gene, right, and we can't convert it, we have a little problem. So we always want to look for that. So with your B12, we want to have that greater than 900. And on the lab forms, those are really the deficiency ranges. They're testing people who are not supplemented. So if you have a really high B12, it's totally good because it's water soluble. You're not going to be going crazy with it, but it's going to be utilized every single day in your body. So when we look at the folic acid, we really want it greater than 20. And the folic acid helps us with our brain and our nervous system. So these are really, really important. And these two vitamins in deficiencies can also be called pernicious anemia. So we don't want to have an anemia where we're deficient in our blood. So some of the other things we're going to look at our vitamin D. And we know the vitamin D is huge. It supports our immune system, our heart, our bones, our brain, and it even can help with cancer spreading prevention. Right? Specifically melanoma, which is kind of interesting because we all say, well, we get a lot of vitamin D from the sun, but really we're not getting as much as we think. So unless you're supplementing, you're probably deficient. The range that we like to see this in is between 60 and 80. And some people just barely getting over into the range at like 30, 31. They think that they have enough, but really you want to be in this better range. And on the other side, you don't want to go too high. If you go too high, you can have a risk of getting kidney stones. So I would recommend getting your vitamin D checked regularly because it is something that different people absorb and hold on to vitamin D differently, and you don't know unless you test, right? So the next one we're going to look at is CoQ10. So we want CoQ10 greater than 1.4. CoQ10 is great. It's probably one of my favorite supplements. It gives us energy and it's great for heart. It's great for anti-aging. And magnesium. So magnesium we want between 2.2 and 2.6, and it supports the brain, muscles, bone, and heart function. We'll do another video coming up on the different types of magnesium. There's 7 different types, and we'll talk about that a little bit later. So let's talk about the benefits of vitamin D. It's going to aid in weight loss and belly fat reduction, right? That's an awesome side effect or benefit, right? So immune system risks of cold and flu are reduced with it. It's going to reduce your risk of osteoporosis, especially if we combine it with something called K2, another vitamin. It's been very, very beneficial in building bone. And it doesn't have the risk that the calcium has that we now know about of, getting hardening of the arteries and plaquing if you're taking too much calcium. It's great for heart health. It helps with our cholesterol. It helps prevent blood clots, heart attacks, and strokes. Vitamin D helps stop the spreading of cancers. Hopefully you're not getting them in the first place, right? And then it also helps brain boost, right? So it's going to help you with seasonal affect disorder, insomnia, things like that. So we want to make sure we got plenty of vitamin D. You can also get it from food, but you're still not going to get enough. So you're going to want to supplement. But these are some of the good sources in food: salmon, tuna, mushrooms, fortified milk. If you're a dairy drinker, cod liver oil, fortified cereals, eggs, and of course, sunlight. So we use supplements from a company called Zymogen, and they're pharmaceutical grade. You can't just buy them on the internet. They have to go through physicians. So if you are interested in vitamin D, or this is the multi-active essentials where it has those B vitamins in it, at wholescripts.com, you have to have a passcode. Ours is Get Healthy. And of course, the doctor's name is McLaughlin. So let's talk about the benefits of CoQ10. I love CoQ10, by the way. It is awesome. So it improves your natural energy. It helps with free radical damage. So it protects your cell membranes and it helps fight those free radicals that kind of happen with age. It slows down the aging effect and it slows down muscle degeneration. It also has a great heart health benefit. It offsets the side effects of statins. We know that people taking statins a lot of times can get musculoskeletal aches and pains. We see them a lot here in our office. So the CoQ10 is what the statin depletes. So by taking it, you can minimize those aches and pains. It's a great, combination. The brain, it helps with cognitive disorders and improves your energy. Now, magnesium, it's a natural muscle relaxer and it boosts your performance in athletics. It helps with immune system. It helps alleviate PMS. And again, there's different forms for different things, but magnesium overall is an excellent supplement. It helps improve blood sugar. It helps reduce blood pressure. It helps enhance sleep and reduce insomnia, and helps with the brain, right? Prevents tension, migraine, headaches, and it fights against depression. So now the last deficiency we're going to look at is essential fatty acids, omega-3 and omega-6. So essential fatty acids may control many vital organ systems and reduce overall inflammation. They're great anti-inflammatories, the omega-3s, right? So omega-3 is a fish oil. This is an essential fatty acid that's not produced by the body. So you have to either get it in your diet, like from fatty cold water fish, or from a supplement. So in a lab test, you'd want that greater than 4.5. And now there's two parts in that omega-3. There's something that's called the EPA. And if you're one of my patients, we talk about this all the time. You want that greater than 50 in the blood, but that helps lower the LDL cholesterol. In some people, depending on their genetics, if they take the DHA form of the fish oil, it can raise their cholesterol. So we don't want that. But the DHA is great for brain health. And we see that a lot in infant formulas. We see that a lot giving that to kids. And we want that level to be greater than 100. So what about unsaturated fats? We want that greater than 22. And it helps lower cholesterol and inflammation. Almonds, avocados, and olive oil are a good example of things that are high in monounsaturated fats, or the healthy fats. And then the ALA, these are also good fats. They're in walnuts, chia seeds, and flaxseed oil. So the benefits of some omega-3s, it's going to aid in kidney function. It helps with dry eye and age-related disorders like macular degeneration, especially in the omega-6 category. And we don't want to have too much 6 without having enough 3, right? We need that balance. It helps with chronic skin problems and eczema. Of course, heart health, because it can help lower cholesterol. It is anti-inflammatory, and it also thins the blood to prevent blood clots, heart attacks, and strokes. And it helps with the joints because being anti-inflammatory, and because of the DHA, it helps memory, cognition, ADD, mood disorders, anxiety, and depression. There's tons of studies on the benefits of these nutrients as well. So some good food sources are going to be flaxseed, walnuts, sardines, salmon, avocados, almonds, shrimp, and olive oil. One thing I want to say is, some of these things, it's easy to eat a lot of them, right? So like if you had almonds and they taste pretty good and you want to eat a bunch, you don't want too much, right? Everything in moderation. So average serving size, like almonds, would be like 10 almonds. If you had just 2 or 3 walnuts, because they're so dense in calories and in these oils, you don't need much. So just be careful with your quantities on eating some of these healthy foods. So that's it for the deficiency basket. And if you have any questions, just let us know at 847-234-2346. Be sure to subscribe to our channel and like us on Facebook, and we'll be seeing you in the next video.